One of the most frequent injuries that take place related to patient handling with nurses is when we are repositioning a patient up in bed. Now, technology that we have here at UCSF Medical Center to help our staff perform that task and reduce the risk of injury related to it is called a MaxiSlide. It's a frictionless sheet, and you use them in pairs. They look like this. They're purple. When you rub them, the surfaces rub together. They're coated so that they reduce the amount of friction between the two sheets. What we're going to do is we're going to place a pair of sheets underneath the patient and then pull the patient up in bed and then remove the sheets. Okay? The technique that we use to do this, we take the two sheets and we're going to fold them up in 3 or 4 discrete folds. And then, after we remove the pillow, we're going to place the folded sheets under the patient's head. With one hand, grab the loose flap. With the other hand, grab everything that's rolled up underneath, and then unfold the slide together and each discrete fold to get it under the patient. If this patient had the use of her legs, she could push herself up in bed at this point, and then we could just remove the slides. To pull the patient up in bed, we're going to grab the little handles on the side, the shoulders and the hips, and take one step towards the head of the bed. To remove the slides, we take out the bottom slide first, because it's sliding against the top slide, and there's no shearing on the patient. And to take out the top slide, we take this corner, tuck it underneath, and pull it from that side. You're pulling this edge out on that side so that it's shearing against itself and not against the patient. A set of MaxiSlides should be used single patient for the length of stay or until they're physically soiled. If they're physically soiled, throw them in the laundry. They'll get recycled back to supply, and they are reusable. If you don't know where they are on your unit, ask the charge nurse or your nurse manager, and they'll let you know where that you can find a set to use them. If you're going to use them on a patient and you identify a patient that they're a good candidate for, leave a set in the room so that they're there when you need them.